So, continuation of previous video. Just we are wrapping this anti-anginal drug. Now, already we know what is angina. We have seen this. There is the three different form of the angina. That is stable, unstable, and the variant. Now, we have seen the different types of the drugs we can use. You can say that. For the anti-anginal drug. Now, what are the different drugs? For example, beta blocker except vasoplastic angina. In case of the except vasoplastic angina, they can useful to reduce the frequency of the coronary events. Nitrates, of course, it is one of the important drug and prevent the extensional angina, suitable for the relief of the acute angina and for the long-term treatment. So this is again nitrates having the very good activity into the, and they can be used as a you can say that in case of the anginal episode, they can be placed below the tongue and it will be absorbed, so that it will be very helpful. Next is calcium channel blocker, like they are considered as a second line drug. It is these are the indicated in case of the contraindication to beta blocker or in addition to the beta blocker. Next is ranolazine, so that is mainly used for the stable angina, that is refractory to the first line treatment. And there is, we have seen that there is a majorly two mechanism which reduce the myocardial oxygen demand. What? Inhibit late phase sodium efflux into cardiac myocyte. So if we can inhibit the late phase sodium efflux into the cardiac myocyte, then it will reduce the calcium flux and it will cause useful to reduce the stress and oxygen demand, wall stress and the oxygen demand. Similarly, decrease the rate of the fatty acid beta oxidation, that means aerobic process. As we have discussed in our first part, if we can able to reduce this aerobic process, then what will happen? Then it will be helpful to reduce the pain and other things. You can say that generally we can observe for the angina pectoris. So generally as a combination therapy, you can say that we can give. If the monotherapy is not found suitable, then beta blocker with nitrate, calcium channel blocker with nitrate, beta blocker, calcium or calcium channel blocker. So these are the major drugs we can use for the treatment of the angina pectoris. So as we have told that these are the some of the reference you can go through for further reading. Uh, uh, so this is the about the anti-anginal drug.